Why might I still have polyps if I'm a vegetarian? Great question. Find out on this next episode of Digest This.
Welcome to Digest This, the show that helps you revolutionize your digestive health. Here are your hosts, Dr. Liz Cruz and Tina Nunziato.
Hello, and welcome to Digest This. I'm Dr. Liz Cruz, and I've got Tina Nunziato sitting right here by my side. Thank you so much for joining us. We know that everybody has such busy, hectic lives, schedules, everything. And so the fact that you are taking time to hang out with us, whether you're listening or watching us on YouTube, means so much to us. So thank you so much. So why would I have colon polyps?
Where did this question come from? I love these questions.
Me too. I love them too.
Randomly throughout the week.
Yeah, and it was from a patient who woke up from her procedure for me to tell her that she had colon polyps, and she was devastated. Mm-hmm. She was devastated, and
how many did she have?
Oh, I can't remember.
Like a lot, like more than 5?
No, I think it was a few, and they were actually very small, and.
Okay.
And she was like, how could that be? Why would I have polyps if I'm vegetarian? I was like, oh my goodness, that's such a great question. Mm-hmm. Such a great question. And I just thought that it would be something that, we should talk about. Mm-hmm. So should I not have any polyps at all if I'm vegetarian? I mean, I think first of all, the question is, what is vegetarianism to you?
Exactly.
Because being vegetarian, and I didn't go into this discussion with that patient because the patient was just waking up from, having sedation and so I didn't discuss it in detail. But being vegetarian can mean a lot of different things, and some people that are vegetarian eat a lot of carbs. And really don't have much in the way of vegetables, greens, but because they don't eat meat, they're vegetarian, right?
You could be a vegan and still eat Oreos every night.
Absolutely.
So absolutely. I think that's the first thing is just because you're vegetarian doesn't necessarily mean you eat healthy.
Right.
Right. So,
and we're not here making any judgments or saying, but that's
the reality of it, right?
Right.
But there's multiple factors that go into getting polyps. So let's talk about that, right? So diet is one of them.
Diet.
Detoxing, right? The ability for the body to detox properly is one of them. I would imagine
family history,
genetics, right?
Genetics.
So
absolutely.
No matter how you eat, no matter how well your body detoxes, you probably still can end up with polyps because of just, your genetics.
And even if you've had polyps before, it's, especially if you've had precancerous colon polyps, that in itself is a risk factor for developing more colon polyps in the future.
Right.
Okay, now, patients ask me all the time, okay, well, what can I do to prevent the growth of polyps in the future, and which ties into this because it's a great question, and it's a lot of greens,
right? But even the way you prepare your food. So, for example, there's been a huge tie of colon polyps and colon cancer to barbecuing.
Absolutely,
right? Smoking your food, barbecuing your food, no matter if it's on a grill that has coal or on a grill that has gas.
Right.
And why is that? It's because those chemicals from the gas or the coal or the smoking can get into the tissue of the body, right? So even if you were eating vegetables and you loved asparagus and peppers and you grilled them, right, that could, again, contribute to polyps.
Right.
So there's a lot of factors around that. Obviously, eating cleaner, right, and eating more vegetables can help. Working on ways to detox the body properly.
Absolutely.
Making sure you're having regular bowel movements, right? Because you could be vegetarian or vegan and you could be constipated, right? Still constipated, not having bowel movements every day.
Right.
Some people think that having a bowel movement every 3 days is normal.
Right.
That's not normal, right? So
well, that may be normal for them, but that's not good for the body.
Right.
Okay, your body needs to be evacuating and pooping having a bowel movement is one of the several ways that it detoxifies your body. So it's true. There's a lot of factors that play into it. Sometimes it's hard to tease out those factors. I mean, even several years ago, I think like in 2018 or 2017, the American Cancer Society came out with a statement on the intake of red meat and processed meats being a risk factor for colon cancer. So what does that mean? Well, red meat, processed meats, hot dogs, lunch meat, sausages, bacon, any of that stuff, because of the chemicals in these meats, the carcinogens, the fat. The fat in red meat. I mean, there's actually several things, not just the fat, but several things. All these things can actually increase your risk for colon cancer.
Right.
And so sometimes patients, we'll have this discussion and they're like, I eat some form of meat every day, red meat or bacon or sausage, and it's like, okay, well, maybe in moderation, maybe instead of every day, maybe just
do it on the weekends.
On the weekends, exactly. The greens are very important, because greens are what give life to your cells. Now, maybe you are eating a completely, vegetarian, no meat, super healthy, lots of greens, drinking a lot of water to keep yourself flushed, not a lot of, nothing in the way of junk food.
Having good bowel movements every day.
Bowel movements. Could you still have polyps then? Yes, you can. However, it's a cumulative effect of all these good things you're doing, okay? So let's fast forward now, 10 years from now, and you have a colonoscopy. Let's say you have 1 or 2 or a few small polyps. What would you have had if you had not been having this very healthy lifestyle of eating healthy, taking care of your body, eliminating, drinking a lot of water? It's possible that maybe you would have had 20 polyps or maybe even a tumor, okay?
And some of them, like you said, not good polyps, right?
Exactly.
Like in her case, the patient asked you, maybe she had just a few polyps and they all were small. And, probably none of them cancerous. So that's a thing, right? Or even precancer.
Right.
So it's not only the number of polyps you have, but it's also what kind of polyp is it? How big is it, right? So to your point, every little thing you do is going to contribute toward the number of polyps you have, the size of those polyps, and how bad they are.
Exactly.
Right.
Exactly.
So there's a lot of factors.
Right. So if you're on a great diet, you're vegetarian, eating well, and you happen to have some polyps, don't let that freak you out. Don't let that stress you out. Don't let that discourage you to be like, wow, I've been doing all this and now I have polyps. Forget it. No, don't. Keep doing what you're doing. Eat healthy, drink a lot of water, and keep doing these amazing lifestyle, healthy lifestyle habits that you've developed. Keep doing it, because you don't know, and you probably will never know, if it prevents you from someday developing something worse, like a colon cancer.
Or any other form of cancer.
Or any other form of cancer.
I mean, let's admit it. I mean, eating healthy and drinking water isn't going to stop just colon cancer. It's going to slow down all forms of cancer.
Exactly.
Right.
Yeah, exactly. So and remember, everything plays into it. I mean, get the exercise that you need. If you're eating a healthy vegetarian diet, but you're smoking a pack a day, I mean, all of that plays into it,
Right.
Or like Tina said, eating a completely vegetarian diet, but you're grilling or barbecuing everything you eat, all your vegetables. Unfortunately, there's carcinogens, in barbecued food, just because of the way that it cooks.
Yeah.
So,
yeah, there's a lot of factors.
Yeah, several factors. But don't give up.
Right.
Don't give up. Don't stop doing what you're doing. Stay healthy. It will pay off. It will pay off. And don't be discouraged if you go and have a colonoscopy and are found to have some polyps, okay?
And don't not have your colonoscopy because you think, well, I eat healthy, I poop regularly, I drink a lot of water, I don't have family history, whatever you feel are the risk factors and you feel like, oh, I'm nailing all these and I don't need to have a colonoscopy, that's crazy sauce, okay? You still need to have a colonoscopy because it is one of the easiest tests that you can do to prevent colon cancer. And literally, you're knocked out for the whole thing. You don't even know what's going on. So it's one of the simplest things for you to, even if you have one little baby polyp, if you have it and you're young and you don't get it taken out, that thing can turn into cancer. And it can turn into cancer when you're 50 or 60. And I don't know about you, but I want to live way past 50 and 60. So, please don't wait to have a colonoscopy just because you feel like you don't have, any of the risk factors.
That's right. That's a great point. Thanks for bringing that up. All right. Well, if you'd like to connect with us, please go to our website, drlizcruz.com. There's a magenta colored button on the homepage that you can click and schedule a free 30-minute wellness consult. And that is done over the phone. So that's for anyone. You don't have to be a patient in our practice. Anyone can do it from anywhere in the world. So please get yourself scheduled for that. If you haven't rated our show, please give us a rating and please give us a 5 so that other people can find us faster. And lastly, if you have not subscribed to this show, please subscribe so that you never miss an episode. Thank you so much for joining us, and we will catch you on the next podcast.
Thank you for joining Dr. Liz Cruz and Tina Nunziato. To learn more about their revolutionary products and services, go online to www.drlizcruz.com.